The work that you've done so far this semester has gotten you off to a good start on what you want to do for your research proposal. We're going to continue to develop that over the next several weeks. And so I want to talk to you a little bit about writing your research proposal because that will tie into this week's assignments. When you're writing a research proposal, it is important that you develop your ideas logically. That is why we are taking this piece by piece rather than just presenting you the idea of a research proposal and expecting you to do it all the week 16 of the semester. When you are writing a research proposal, you need to determine the depth of the proposal or what needs to be included, and that is governed by the guidelines of your institution as well as where you are submitting the research proposal. So if you're submitting it for an institutional review board for a hospital or a university, those guidelines would be in place. If you are submitting it for funding, such as a grant, then you would follow their guidelines. But for this course, or for any other research course you take if you might go on to graduate work, it is the instructor's guidelines that determine what must be included. The research proposal identifies the critical content, and that's what you have been doing bit by bit. So one of the first things you're going to do when we actually get to the rough draft is to give a little bit of background, and this will help build the significance of the research problem. This is part of the reason you are starting to look at the literature. You also give the purpose of the proposal. You do not need to state your research objectives, but your hypothesis is certainly going to be included in your research proposal, as well as your research design, which we just talked about. So, what is the plan to find an answer to your research question? And again, going beyond that, then, what would the actual production plans be? You're not going to perform the research that you're proposing. It still needs to be logical and feasible and executable, but there's not enough time in the semester to make that happen. You have two assignments for this week, and the first one is to create a PCOT, and PCOT identifies the major components of a research study. When you do this, all you need to do is list each of these initials and what goes next to it, and then even a few words, a single sentence about each of these 5 components will suffice. So the P is the population or the patient. So who is your patient? Are you looking at a certain group of individuals with the disease? Are you looking at a certain group of individuals that are undergoing a procedure, whether it be a CT examination or an ultrasound examination or radiation therapy? Are you looking at a certain group of individuals who work in an area of healthcare? The I is the intervention. What are you planning to do to at least some of these individuals? Are you going to manipulate the independent variable? For some of you, there might not be an intervention. If you're just going to watch the normal course of events, then you wouldn't have an intervention. So then you're going to say no intervention will be performed. The C is the comparison or the control. So how are you going to determine if you find results that matter, meaning if they are results that are significant? So this will depend on your type of study. Maybe you're looking at patients who have 2 different imaging exams. Maybe you're looking at patients before and after an exam or an injection or a treatment. Okay, so what is your comparison? The O is the outcome or the objective. So what are you looking for? What in your hypothesis had that directional portion to your hypothesis? And then the T is the time period. So over what time frame will this research study occur? For some of you, it might be a single day. okay, that the patient has a CT examination and an MRI examination the same day or the same week. It might be that you're looking for a recurrence of cancer in a patient and you're going to look over 10 years. So that absolutely depends on your study. So that is your PCOT assignment for this week. You're going to list each of these 5 components and you're going to describe them for your study. And the reason I'm having you do this is because I want you to think about each aspect of your study at a time where you still have the ability to build it and to alter it rather than when we get to the end of the semester. Okay, so this is broad thinking. This is progressing from the hypothesis to the next step. How would this really be executed? Okay, so that's assignment number 1 for this week. Shortly thereafter, next week you're going to have an outline due, then after that you have a rough draft due. So what's that going to look like? Well, in a student proposal for this course, you will have an introduction. So the purpose of the introduction is to identify the topic and the problem and to allow the reader to get some background and some significance of the problem. When you write a research proposal, it goes to the institutional review board for the hospital or the university if you're working in academia or even in an academic hospital. The institutional review board is made up of individuals who review the proposals to make sure that they are sound and logical and don't harm any of the participants in the study. These individuals have some level of education, but they're not necessarily in the discipline you're studying right now. So sometimes they are nurses, generally they are physicians, typically there's a member of the clergy, there may be other individuals from institution as well. But it might be unlikely that there is a sonographer or radiation therapist or a CT technologist or an MRI technologist on that institutional review board. So even though there are concerns or quandaries that are inherent in your particular field, you need to not expect that whoever is reading your proposal will be familiar with those concerns. So that's part of what the introduction does for you. Then you're going to provide a review of the relevant literature. This will be the literature review that you turn in next week, I believe. And so this is going to be a several paragraph summary that again helps to build the background and explains what has already been researched and shows why this particular topic still needs to be investigated. So this is a relevant review of both theoretical as well as empirical literature, depending on your topic. Then you're going to build the framework of your research objectives and your hypothesis. Any important concepts or relationships should be included. This will identify your hypothesis and define the research variables. So whoever's reading this will be able to tell without having the words independent variable and dependent variable in your hypothesis that these are the variables and the relationship that is expected. If there are any relevant terms that are not wide known to an educated public, sometimes you'll need to put a glossary of relevant terms as well, especially if you have a lot of acronyms that you'll be using in your proposal. Then you're going to talk about the methods and the procedures. So what is the research design? Is this a true experimental study? Is this a retrospective study? And that depends on the topic that you're studying. What is the setting? Now for your proposal, it would be logical to choose perhaps your clinical site, but if you're studying a disease that only occurs in children and your clinical site is an adult facility, then you would need to choose a pediatric hospital. Because you're not going to be performing this, as long as the setting is logical, then it will be acceptable. how will the participants be selected, and what will the number of participants be? And this needs to be representative of what happens in real life. So you can't just study one or two individuals unless it's an extremely rare disease, and it's probably unlikely that you're going to get 50,000 participants either. So when we talk about statistics, you're going to see that there is a certain amount of participants that we'd like, and there's something called a power analysis that says in order to be able to derive statistics, we need to be able to perform we can perform a power analysis to determine how many subjects we need. Typically that number is at least 50. Okay. And then, are there any inclusion or exclusion criteria? If this is a subject, or if this is a study that would involve additional radiation exposure for imaging, maybe you want to not include people that are under the age of 18. Or if it's a study of pregnancy, then one of the inclusion criteria would be that the patient is pregnant. If it's a study of prostate cancer, then it would have to be a patient who has not undergone a prostatectomy. What kind of ethical protection will be provided to the participants? So you need to have a statement down the road about confidentiality, if there are any ethical issues depending on the topic, and then if there needs to be an informed consent, you will comment upon that, and then you will have an informed consent document in the appendix. And once we get to this point where you're writing the rough draft, I will post a template informed consent that you can use. It's not plagiarism, and it's widely available. Institutional review boards make these available for all of their participating hospitals, so that's not a problem. Essentially, if you're doing anything to an individual that's not part of the standard of care, you need informed consent. If you are looking retrospectively at data that's already available, you do not need informed consent. You need to be sure that in this research design section there is discussion of the intervention that is to be measured, what will the researcher and others do, how that data will be measured or collected, whether or not there's randomization. If it's a true experimental study, there will be randomization in your study. And then if there are any obvious strengths and weaknesses of the design. For example, this can only be performed when a certain physician is present, so that might be a weakness. Or you see a diverse population and a large number of patients in an institution that suffer from this disease or this side effect, that might be a strength. We'll talk about statistics in a few weeks, and so you need to have a single statement about statistical analysis. And that statement will be, statistical analysis will be performed using, and then you're going to put the appropriate test. We will meet to talk about your rough drafts. We'll meet individually, and we can talk specifically about your individual proposal at that time also. A study timetable. Again, will this take one visit and you can have all the data collected within 3 months? Will you need to look at that patient annually for 10 years? It depends on what you're studying. You don't need to discuss funding. Most of you won't be able to get that. Sometimes people say, I will approach the Susan G. Komen Foundation for funding. Yeah, you don't need to do that. By the way, that's not what you would say anyway, because you're not going to say I, you, we. There should not be any personal pronouns in your proposal. And then if there are any limitations of the design, you can discuss those and what are the plans for dissemination of the findings. This research will be published in the Journal of Diagnostic Medical Sonography, for example. If you need an informed consent document, that would be included as an appendix, as will sample data collection forms. If I've not already done so, I have to go back and look. I will open a sample research proposal. I'm pretty sure I already posted one, but I'll put a few up, and that way you can take a look at them and see how these individual elements are included. So the reason I gave you this now is so you can have a direction going forward on what it is you're supposed to be doing for the next 8 or 9 weeks. But I wanted to talk to you about PCOT so you know what the assignment is for this week, and that is the introduction to everything else I just talked about for the last 10 minutes. The second assignment for this week relates to the last thing in your proposal, which are the references. Everyone has turned in their first article. You have seen my comments on it. If you have any comments about my comments, please let me know. So what I want you to do is continue to search for sources. And for now, you do not have to write a paragraph summary like you turned in. That was just for me to see why you were using that article and the key points of that article. For the second assignment for this week, I want you to compile a chart about your references. Okay, so by the end of this week, I would like you to have 5 references. Hopefully you've still been looking around a little bit. And what I want you to do is make something that looks like this chart. And I want you to list the author's names, the source, and by the source I mean the bibliographic information, the journal in which the article is found, and that includes the year of publication, the volume number, the page numbers, okay, the digital object identifier or the DOI. Don't tell me it came from Elsevier. Don't tell me it came from the National Library of Medicine. Don't tell me it came from PubMed, because those all came from journals. The purpose of having bibliographic information is that if a reader wants to look at your original article, they can easily find it. And so some of you on your first articles, I wrote things like, this isn't the real citation. I put the original citation. That's the reason why. You'll put the year of publication, you'll put the article type, whether it's a research article or a review article. Remember, I posted a little summary about that, giving you a couple of examples on ultrasound contrast in the kidneys from work we've done. But if the article states, in this study, we examined 10 patients, 20 patients, 3,000 patients, that's a research article. If it says in a study by Jones, this was done, and in a study by Smith, this was done, and in a study by Anderson, this was done, not as part of the literature review, but that's the entire article, that's a review article. Okay, if there's no materials and methods section, that's a review article. And then I want you to give the key findings or conclusions. Typically, there is a part of the paper that says that, but you can also use that as your own summary of the information. You do not have to submit the PDFs with this. You're going to have to do it when you write your paragraph summaries of each of these, but I'm going to use the bibliographic information that you submit to find your articles. So please be sure it is correct and the DOIs are correct, because that will be part of the grading. So for each of these 5 items and each of these 5 sources, you will get a point, meaning this assignment is worth 25 points. This is going to be the lead-in to the longer written summary that you give me. You will give me. This is the first time I've done a chart like this, and it's because once we get to the next portion of literature review, there have been a lot of problems with that in the past. So I'm trying to head off those problems and make this a more logical assignment for you. If you have any questions about this, let me know. Otherwise, I look forward to seeing your work at the end of this week.